A lot of people are asking the question, how did SARS-CoV-2, the virus that causes COVID-19, emerge? And was it human behavior? Was it a wet market in China that led to a spillover event? And if so, what can we do about it? And how can we be sensitive to other cultures and their practices while at the same time trying to prevent something like this from happening again? And these are all excellent and complicated questions. The first thing is that there's a lot of confusion and misinformation out there about the source of this virus. The simple answer is we don't exactly know where this virus came from. The early investigations of the outbreak led investigators to a market, sometimes called a wet market, which is really just a food market. It's where people buy and sell food. Sometimes the animals are alive, sometimes they aren't, and these markets sell other things besides animals as well. The early investigations led to one of these markets in Wuhan, China. But the investigations haven't really revealed a perfectly clear link between that market and the cases. We know that coronaviruses spill over from nature. This has happened before, and it will happen again. So it's very, very likely that this coronavirus came to us from an animal, perhaps through an intermediary animal, got into one person, and then began to spread from person to person to person. We don't know what the intermediary animal was. There have been a lot of discussion about that on the internet. The answer is we're not sure. We're pretty certain that the original host, the reservoir species, is a bat. We know that bats harbor coronaviruses, in particular beta coronaviruses, of which SARS-CoV-2 is one. We have seen coronaviruses spill over from bats before. The SARS outbreak in the early 2000s is a great example. Science has been tackling with this question about where emerging infectious diseases come from for the last couple of decades. And what we know is that this is bigger than wet markets. This is bigger than the wildlife trade. And even though wildlife trade is most definitely a risk factor for creating those interfaces, it's not the only source of risk. The emergence of emerging infectious disease has been accelerating, and the reasons for that are almost entirely driven by human behaviors. So it's things like land use change on a massive scale, mass urbanization and demographic shifts, agricultural intensification, climate change. Climate change can shift the presence and prevalence of vectors like mosquitoes that can help transmit infectious disease. The extractives industry, the growth of palm oil plantations and forest clear cutting, all of these are potential risk factors and that may be driving the emergence of infectious diseases like SARS-CoV-2. So if we want to prevent these things from happening in the first place, we need to really holistically understand what all of these risk factors are, and then we need to come up with holistic solutions. There's also working with companies and corporations and getting them to understand that some of their practices may be creating risk factors that put their own bottom line at risk. And companies are beginning to understand that they have an economic imperative as well as a moral imperative to change some of the practices that may be leading to emerging infectious disease. So I think the takeaway is that if we understand the drivers and the risks for emerging infectious disease, whether it's the specific risk that led to the emergence of SARS-CoV-2 or other types of risks that are leading to the emergence of other pathogens that we know will happen in the future, we don't have to be frightened by this reality, but we do need to acknowledge it. We need really good science and research to reveal where the pressure points are and where the entry points are for change, cultural change and business change, and just a change in our mindset about how we want to approach a future in which there are more pandemics that are sure to come. But if we focus on prevention, we might be able to prevent a certain proportion of those. And I think we can do so in a way that incorporates a nuanced understanding of why humans undertake the behaviors that they do that are driving the acceleration of outbreaks.